Hello, everyone. Welcome to the Testing Psychologist podcast, the podcast where we talk all about the business and practice of psychological and neuropsychological assessment. I'm your host, Dr. Jeremy Sharp, licensed psychologist, group practice owner, and private practice coach.
This episode is brought to you by PAR. PAR offers the RIAS-2 and RIST-2 remote to remotely assess or screen clients for intelligence, and they also offer in-person e-stimulus books for these two tests for in-person administration. Learn more at parinc.com.
Hey, everyone. Welcome back to another episode of the podcast. Today is a clinical interview day, and we're talking about a topic that all of us should care a lot about, but many of us, including myself, don't pay enough attention to, and that topic is measurement error in pediatric assessment. My guest today is Dr. Vanessa Torres van Grinsven. Vanessa currently works at the Section for Research Methods of the Department of Special Education and Rehabilitation, Faculty of Human Sciences at the University of Cologne. She runs the Consultancy Center for Empirical Research of the Faculty of Human Sciences and teaches research methods from a qualitative, quantitative, and mixed methods perspective. And I need to correct myself, actually. As of April 1st, she will started working as an assistant professor in methodology at the Faculty of Psychology of the Open University of the Netherlands, Department Theory, Methods, and Statistics. Vanessa studied social and cultural anthropology and philosophy at the University of Barcelona in Spain, and later got her PhD at Utrecht University in the Netherlands on a research methodological topic, after which she specialized in research methods for the social and behavioral sciences, including an interest in measurement issues and personality diversity. So I talk with Vanessa about this topic of measurement error in pediatric assessment. We get into, of course, the basics of measurement error, what that means, why we need to care about it. But more importantly, we talk about how it manifests in our testing. So we spend a lot of time on the intersection of personality and test performance, and the idea, or the debate, I suppose, about tests being completely objective and sterile, or whether there is a more organic interaction between the tests and the individuals taking them. It's a great episode. I think there's a lot to take away, as always, and Vanessa was a fabulous guest. So, without further ado, let's listen to my conversation with Dr. Vanessa Torres van Grinsven. Hey, Vanessa, welcome to the podcast.
Hi, Jeremy, and thank you. And it's really a pleasure to be here and talk about some issues.
Yeah. I'm really, it's funny. I reach out to a lot of folks to come on the podcast, and sometimes I'm a little more certain that they would be open to it. But in your case, not only is there a lot of geographic distance between us, but, time zone stuff, and you have no idea who I am. So I am really grateful that you responded to my random email and agreed to come on and talk about measurement error in pediatric testing. Thanks.
Yeah, you're welcome. And that's true. So I do get some spam. But yes, of course, it's always very important to talk about research results and disseminate, and podcast. I think, it's a really good opportunity to talk about my research work and disseminate, and to let other people hear about it, and not only by reading an article or something. Yeah.
Sure.
Yeah.
Good. Yeah. Well, I'm glad you're here, and I'm excited to talk about it. Yeah.
If I want to say something more, if I can say something more, it's also, I think it's very good that you do this, that you record these podcasts and place them online. I think it's a very good way to disseminate knowledge. So thank you for that. Thank you for your work.
Oh, yeah. Well, I appreciate that. Yeah, it's really all due to guests like yourself who are willing to come on and have these conversations. So it's a joint effort for sure.
Mm-hmm.
So we are talking about measurement error in pediatric assessment. And I will start with the question that I always start with, which is, of all the things that you could focus on in your career in psychology and in this whole world, why spend your time researching this particular topic?
Why this? To start with, and as I also describe in my article, so these tests, they are used a lot. So the risk is used a lot for diagnostics, and then based on these diagnostics, decisions are made for children about treatment, but also maybe about schooling. And so not only the risk, but also many other standardized tests are used nowadays in our society to assess children. And then based on these tests, a lot of important decisions are made. So for that, I think that is really a general importance into doing research into these tests to make sure that they function properly. So that is maybe the rationale behind this research. So I'm not a psychologist, but I'm a methodologist with a background in philosophy and anthropology, but I rolled into this methodology field, doing my PhD research and then teaching research methodology. And then I got into the field of psychology and research methodology for psychology. And from this into measurement and diagnostics. So that is the trajectory through which I got into this and interested in this topic. And this interest comes from this professional background, but also so as a mom, I have 3 kids. So I have a lot of experience with all these standardized tests that kids need to do nowadays. And so one other thing is, so I talked about my PhD research. So I also worked in the field of survey methodology and questionnaire construction. And so in this field, there is a lot of focus on measurement error. And in trying to reduce this measurement error using certain procedures, for example, qualitative pretest procedures that are not used in psychometric testing. So with a combination of this professional background and experience with my kids, I got interested in this topic. And so based on related to testing of my kids, I also got in discussion with psychologists. And because of this background I have in questionnaire construction from survey methodology, I did ask them, do you not think that maybe some measurement error could occur due to certain characteristics? So, and I thought about things like anxiety or fear of failure, insecurity, or maybe attention issues. They were of the opinion, and these few psychologists that I talked to, so I don't know about all psychologists in the world, of course, they were of the opinion that this could not happen. So this really sparked my interest. So is this really possible? And from my background in survey methodology and questionnaire construction, and also knowing a bit how psychometric tests are constructed, this sparked my interest. And I decided to do some research into this, in which I have just started actually. So there is a lot of research to do.
Sure. There's so many pieces that we could talk about. I mean, it sounds like for you had a similar experience to a lot of us, where it's this intersection of personal experience with professional interest, and you have the good fortune, I suppose, or the skill set to really dig into something that felt important, right? Like your kids getting assessed and realizing, like, hey, there could be some problems here, but people don't really pay attention to those problems.
That's true. And it's also related maybe to general discussion about these tests that we have in the Netherlands and issues that could go wrong. And I also had the luck that I had the time and availability to do this. This is also a luxury, I think, to be able to choose your research topic in some way, and something that really sparks my personal interest, and I think is really important. In general, nowadays.
Yeah, yeah. I completely agree. And I think that this is a topic that for a lot of folks, a lot of practicing psychologists, maybe flies under the radar a bit. It's something that we learn about maybe in graduate school, and we know, we have courses on test construction and standardization and measurement error, and the statistical, like the methodological aspects of test development. And I think maybe I'm just speaking for myself, but I think a lot of us quickly forget about all that stuff once we get into practice and just get in the habit of using certain measures, and we lose that scrutiny or that microscope, that we applied back early in our career when evaluating measures. So I'm glad that we're having this conversation. It's very important, right?
Yeah, thank you.
Well, let's start at the beginning, and I would love to have you just define measurement error as it pertains to intelligence testing. That was the focus of your article, so we can at least start there.
Yes. So measurement error. So I think the best way to talk about this is to focus from the viewpoint of measurement instruments. So in psychology, as in other social and behavioral sciences, we design measurement instruments. So that is a concept or a construct we are interested in. These are many different types of constructs and concepts in psychology and other sciences, like, for example, motivation, but also intelligence. So it starts also with the definition of that concept that we are interested in and that we want to measure somehow. So then based on this construct, we develop measurement instruments. And every measurement instrument has issues, of course. So no measurement instrument is perfect. That's maybe also something we forget in practice, that no measurement instrument is perfect, and there could always be some error or some bias. That measurement error would mean, so we have a measurement instrument to measure intelligence, so then we have a certain definition of intelligence. So that is also an issue, actually, but maybe not topic of discussion today, what the definition is of intelligence. So I think also about that, there is a lot of literature and a lot of discussion. So you could fill, I think, also a whole podcast only talking about the definition of intelligence. But let's say that we have this definition of intelligence, maybe in general as a general mental capacity. Then what we want to measure in this test is this general mental capacity. And then measurement error would mean that while we are measuring this general mental capacity, there are actually also other factors come into play into the results of this test. So other factors influence the score, so to speak, that would, let's say, not be part of this original concept of intelligence. So you could define then that as measurement error. So when there are other factors, you can also call them confounding variables that have an influence of this measurement, because of which the score would not be what is called the true score. So it would not correspond to the true score, or also called the consensus score. So these are two different ways to denote it, the true score or the consensus score. So you could say that there is a consensus of what is intelligence, what would be the valid score to measure. And if we get a score that does not correspond to this consensus score, then we have measurement error.
Sure.
So you could define that as measurement error, from a very methodological point of view.
Right. So would you say, is it an oversimplification to say measurement error is anything that influences the score that is not the pure construct that you're trying to measure? It's any external factor. It's anything that might make its way into the score that's not exactly what you're trying to test.
I think that would be a good definition. For that, yes, exactly.
Okay, maybe we could talk about some examples and kind of bring this to life. So, what are some of those variables that might interfere and lead to some measurement error?
Yes, so I got interested in this issue, and so I had different research ideas. I could not yet carry them all out, but I started with doing a review. So I just wanted to know, has that already been researched, that it research into this, what you could call measurement error. So in the literature, it is not always called measurement error. It could also be called test bias. So actually in psychometric testing development, there is a lot of literature on test bias and test fairness. So test fairness is related to this test bias. But what I was interested in is a different type of test bias that has not been researched that much, at least not from the psychometric development point of view. It has been researched, fortunately, so I did find some research in my review. I did not do a systematic review, so it is a review of the literature, but not a systematic review. So I just found some research and I wrote about it. And for me, that was already, let's say, important enough or good enough to write an article about as a kind of summary, like, look, this is some research I found, empirical research that shows how some factors can influence the score in an intelligence test. And some of these researchers, they do focus on the risk. So because I wanted to focus on the most used intelligence test worldwide, which is, according to some authors, the risk scale, so the Vector Intelligence Scale for Children. I thought it would be good to make it more concrete and focus on that test and select research that has done research on those tests. And from here, they found several sources of measurement error. So I call them sources of measurement error. So again, sometimes terminology is a bit different in the literature. I feel that sources is a good way to talk about them.
Sure.
And they found several sources. What comes back a lot is, for example, anxiety in children, depression, social emotional problems, stress and coping variables. Motivation seems to be an important confounding variable. So test taking motivation to take the test, extrinsic motivation. So when you think about material incentives, examining interest, cooperation. So some researchers, they measured traits like avoidance, inattentiveness, uncooperative behaviors. Yeah, these have an influence on the results of the test. Negative emotionality, and then again, avoidance. What also comes back a lot is gender, but I personally am not that much interested in gender, but more what could be behind, because gender is often related with personality traits. So my personal interest is more in these personality traits and how they would be related to the results of these tests.
Could we go down that path just for a little bit, since you expressed that? Could we go down that path just a bit, since you are interested in that area, the personality components?
Yes. So I'm especially interested in the personality components that would have an influence on the results of these tests. And so from the viewpoint of test bias and test fairness, so I also said that there has been a lot of research within psychometrics to do research on this test bias related to cultural background and ethnicity. But there has been no research into personality traits. I guess also because because there are no data. So be able to do research on test bias due to personality traits, you have to have data for that. You have to have collected data for that. And I actually I did do myself also an analysis, but this was not with children. So I found a very nice data set where there was some kind of verbal ability test, but there were also some data on personality traits and demographics. And I did actually found a strong correlation between personality traits and the results of the test, and especially the response behavior. So because that's one, for me, that's one important point. So I've just been mentioning some examples of sources of measurement error. And this can be explained when you look at making such a test from, on one side, the process performance approach that I discuss in my article. So that's not something that I thought of myself. So I cite some researchers in my article, and they were the first to describe this process performance approach to intelligence test results. And this is like opposed to another approach that sees intelligence more as a stable characteristic. So, and this then also goes back to the concept of intelligence and related to the concept of personality. So in general, and there's also discussion about this, but in general, in psychology, intelligence and personality are seen as different aspects of a person. But at the same time, also research shows that they are very much correlated. So at least research shows that certain tests like intelligence tests, but also other standardized mental ability tests, like in USA tests also done in school, I think they're called the GPA and the SAT, they are very much correlated with personality. And also intelligence tests. Empirical analysis show that the results of intelligence tests are correlated with personality traits. And then you could then again approach this from different viewpoints. But if you still want to see intelligence as something, as an aspect that is different than personality, if you want to see them as a dichotomy, then you could wonder whether maybe there is an influence of these personality traits on the results of an intelligence test.
Right.
And you could explain that, so using the process performance approach, but also using a more interactionist approach, as opposed to the more general approach. So generally, tests are seen as an objective and neutral, especially neutral measurement instrument. And another point of view is seeing, let's say, the test-taking process as an interaction. So an interaction occurs between the test and the person. And in this interaction, the personality comes into play. This then leads to a certain response process, which then leads to the outcome of the test. So this is a whole different way of looking at this test and at the process of getting to the score from that test.
Yeah, and to me, that just makes intuitive sense that it would be more of an interaction between the test and the person. Personality factors are going to make a huge difference in how someone responds to a test, but also interactional components between the examiner and the client. That's a whole other area that I imagine we could dig into.
Yeah.
So,
and that makes it maybe even more complicated. So maybe you could have a test and a person making the test by themselves. So there's an interaction between the test and this person. But when you have a test taker, so with children, I believe when you do the risk, there's always a test assessor. So you even have a more complicated interaction. So that you have the child, the test taker, and the test in this interaction.
Sure.
Yeah, and this approach, this interactionist approach, maybe something that comes more from qualitative research and has not really gone into quantitative types of research, of which psychometric test development is a part. And I really think that this could really, be an improvement to also to use this interactionist approach to do research on this response process occurring when going through this process of doing this test.
Yeah. Let me back up just a little bit. You talked about personality characteristics and being related to test taking and outcomes. And for folks who are not familiar with that research, can you share some of that in terms of like what personality characteristics we know of that are related to test performance? Anything that we know about that?
I think that there is no research really on that. So in my review of my article, there are some there are some personal, emotional, and motivational factors that I discuss. But there is nothing much yet about personality.
Okay. Maybe I misunderstood. I apologize. I thought you had said that there was a relationship there with.
Oh yeah, but that's true. Yes, but that's not from the free point of measurement error, but there is research into the correlations between personality and test results. So both GPA and SAT, and also intelligence tests. And so if I remember well, and actually I have this research here, so maybe I can just to try to remember. There are in personality, you have different personality inventories. And one of the most used is the Big Five personality inventory.
Yeah.
And especially the traits, openness to new experience. And I think neuroticism are related to results of intelligence measures. This does actually fit in certain frameworks of intelligence where openness to new experience, one part of it is also, I think, even called intellect. So that is already conceptually a correlation between these. And can I mention the literature, just if someone would like to read it? So there is a chapter by de Jong called Intelligence and Personality, which is published in the Cambridge Handbook of Intelligence. And here this dichotomy between intelligence and personality is discussed, and also some correlations. And the correlations, I think the only significant correlation that he finds is between openness as a personality trait, openness to new experience, and intelligence. And then there is research where GPA and SAT scores are correlated with also personality inventories. And I think they also used the Big Five personality inventory, if I'm correct. Because again, there are different personality inventories that are again based on different conceptualizations of personality and intelligence. And I think they also mainly find a correlation between openness to new experience and the results of the GPA and SAT, or I don't know how you call them in the US. Are they called SAT or SAT?
Yeah, yes, SAT. Yes.
SAT. Okay. And so this, this could mean that these two are actually not really separated, that they are part of the same phenomenon in reality. It could also mean that we are confusing the measurements. So these are two different viewpoints that you could have to explain these research results. And then, also these people who did research on the correlations between the GPA and SAT scores. They also found correlations with conscientiousness, and maybe also agreeableness. But the largest correlations, if I remember well now, are with again openness.
Sure.
Openness to new experience.
Yes, that makes sense to me. And so these are factors that need to be aware of as we are administering these tests to our clients, which gets back to this idea of an interaction between the test and the client. Can you say any more about this? Like when you say an interaction between the test and the client and what that entails?
Yes, so I can look at it from this viewpoint that I have from questionnaire construction and survey methodology, where you look in detail at the questionnaire. So you look at certain types of traits also of this questionnaire, like question wording, answer format, even layout. And all these, in survey methodology, it is proven that all these are really related to the data that you get from such a questionnaire. So how you word a question, of course, but even the order of the question and the answer format has a lot of influence on the data that you get. And when you look at intelligence tests and at the risk, for example, so of course you always have the content of what is asked for. So the risk, do I say it right like this in English? Do you say it like this in English?
Yeah.
The risk has several indexes or indices. Again, I'm not sure how you say it in English, and subtests. And each one of these are supposed to measure a certain ability in the child. So that is, let's say, the content. But then there's also the form. So this is asked in a certain way. Some parts of the risk 3, at least, I'm not exactly aware of the risk 5, I think you'll be able to tell me better, are with a time restriction, for example.
Sure.
And research shows that certain personality traits react differently to this time restriction, which you can also logically explain. If someone is more insecure or has anxiety or has fear of failure, this time restriction can function in a negative way on the performance. So this would lead to a lower performance. But there could be also personalities by which this would lead to a higher performance. So I can also imagine a personality that is actually stimulated by a time restriction. So in this way, personality interacts with the form in which this trait is tested. And you could look like this at each one of these subtests and look at all these characteristics of these subtests, which I have not done yet, but this would be one of the next research to do, to really look in detail to all of these subtests and to make an inventory of the form, how they are questioned, and to do research on how different personalities react differently to these different subtests. So on the other hand, there could be also subtests. So for example, there could also be personalities who are more impulsive in their reaction. And depending on how the test is designed, this then can again have a negative or a positive influence on the results of the test, on the score. And that was important that to know or to think of is whether this influence, so I talked about time restriction, it can be related to, for example, anxiety or impulsivity, if these are part of this concept that you want to measure, or if they are external factors and just confounding variables in this measurement. But then the thing is that also about this, there can be also discussion. So someone could say, but this is all part of intelligence. But that is also, again, this discussion, what are we measuring, and are we really measuring what we want to measure?
Yeah. The question was coming to my mind that's sort of a devil's advocate question, which is, okay, yes, I think it's a given that personality, we'll just say personality, is going to influence test performance, right? And we'll just take anxiety. Like some folks get more anxious when things are timed, and that decreases their performance. Some folks get excited about a time pressure, and that like amplifies their performance, right? Makes it better. So the devil's advocate question is, well, can't we just trust that all of that variability is accounted for in the test development and standardization? Like, how much do we really have to pay attention to that?
Let's take a break to hear from our featured partner. The RIAS-2 and RIST-2 are trusted gold standard tests of intelligence. For clinicians using teleassessment, PAR offers the RIAS-2 remote, which allows you to remotely assess clients, and the RIST-2 remote, which lets you screen clients remotely for general intelligence. For those practicing in the office, PAR has in-person e-stimulus books for both the RIAS-2 and the RIST-2. These are electronic versions of the original paper stimulus books that are an equivalent, convenient, and more hygienic alternative when administering these tests in person. Learn more at parinc.com/RIAS2_remote. All right, let's get back to the podcast.
I would say, so based on the review of research that I did, that we cannot trust on that. So that
I thought you might say that.
that is really this influence. And let's say I don't have answers. I just have this, this review, let's say. And I think this deserves more research. And up to now, all these tests, they are researched a lot with all these psychometric procedures. And maybe we could also do a more qualitative type of research into this response process. So that is also my suggestion, to do more in-depth and detailed research into the response process occurring, to see this from the interactionist point of view, from the process performance point of view, and wonder. So when we do an intelligence test, we assume that we get, or we want to get the maximum performance of that person. But depending on how the test is designed, in relation with personality, we could or could not get this maximal performance. And this is maybe more normative. It's not scientific, but normative. Maybe if we want to give everyone a fair chance, we should do research into how to give everyone a different personalities this fair chance of getting this maximal performance. And if time restriction, is negative to certain personalities, or positive to certain personalities, then maybe this is not fair. So we could think of it from the point of test fairness and inclusivity, and also diversity. So what do we want to do with this? And this is maybe a normative question, and based on our values, so the choices we would make about these tests.
Yeah. So this is such an interesting discussion. I couldn't anticipate this is where we were going to go, but here we are, and I'm really interested in this whole thing. So my question is, yes, like theoretically, I agree with that proposal that our tests should be as fair as possible to as many people as possible, right? Like if we're really trying to measure intelligence, we should find a way to do that in a way that kind of maximizes everyone's potential on these tests, right? And on the flip side, and this is just a theoretical question, I'll put it to you to see what you think. With the amount of variability in personality and performance factors among kids, let's just say kids, is it possible? Is it possible to do that without having 90 different intelligence tests to capture all these factors that would maximize people's performance?
I don't know, and I think maybe possibly not. So maybe yes, this would make the situation very complicated, and maybe it would not be possible to design a test that can be adaptive to different personality traits, or that can be really neutral, completely neutral. So maybe this is not possible. I think for now, this concerning the state of the art at this moment, I think it would deserve a chance to continue doing research on this and to try to improve these tests in general. But maybe also a solution would be to to accept that this occurs, and but then especially to take this into account in how we interpret tests and how we use the results of these tests. So nowadays, results maybe are used very much as how do you say, as an absolute value. So you have an absolute value, below this value this happens, below that value that happens. And maybe it's important to, from a more qualitative viewpoint, then look at these other issues, and that, for example, maybe a psychologist, when doing a test, maybe you can already identify certain issues in children, of which that maybe research shows that it has an influence. So when you do this interpretation and you decide on a treatment, or do you decide on another something different, like in schooling, then you take all these other considerations also into account. So maybe that would be also a part of the solution, of this issue.
Yeah. I mean, that strikes me as a much more realistic and timely solution to this problem, right? I mean, let's assume maybe we could develop tests that maximize everyone's potential, maybe, but that will probably take time. And in the meantime, though, we are left with this question of, okay, how do we use the data that we have, as far as, if we notice that a kid is really anxious during a timed test. I'm curious, like, how you look at it in terms of interpreting that information. Like, how do you actually use that, or how would you recommend that we use that when we're interpreting the data, even if, qualitatively? I think that's how it would have to happen, right?
Of course, that's something that I don't know, and I think I also couldn't be able to tell you, because you know more about that than I. You are a psychologist, so you are practicing, and you are allowed to make those kind of decisions.
That's fair.
And I'm not even. I don't have the papers for that, let's say. But maybe in general in society, we could try to be more tolerant of these issues, and less strict with these kind of test results. And this again has to do also with inclusivity and diversity. So maybe in general, we live in a society that asks a lot of people, and we always have to perform at our maximum. And maybe some people then are disadvantaged by that. But I think in general, so as research shows that these things happen, these could be taken into account in the interpretation. And it is true, it would take a lot of years or time to do research on these issues, on this response process, and from this try to develop new tests. And that's true. So that would be a long shot. Maybe an issue also is that some of these most used tests, like the risk, they are protected by copyright. They cost a lot of money, and this also makes it more hard to do research on them. So it makes it more hard for researchers like me. I'm interested in the response process, and I would like to do research on this because I feel it's an important topic for society. But it's hard because of this protection of the test. So maybe also, I don't know if that's a solution, but moving towards more open access tests that are more easily available for researchers to get into and to do research on, to help develop them and improve them, would maybe also be something to think about.
Yeah. I think it's okay to dream a little bit and think about how we could figure this out a little bit more. It makes me think about the push for digital assessment measures and all the capabilities that we think we have with, as assessment measures become more digital, where, we're measuring things sort of behind the scenes that clients may not be aware of. So that, and I'm thinking like response time, or, whether things are, whether they get the answer right or not. Digital assessment sort of hides, some of those factors a little better than paper and pencil
Mm-hmm.
administration. And I wonder if that opens some doors to make testing a little less intimidating for those folks who don't do well, if they feel more anxious during test taking situations, if we can sort of hide some of those variables a little bit. That's just one thing
Yeah.
that comes to mind for me.
Yeah, I think that could be a solution, because yes, then you would have all these data that would at least help you to assess these issues. And then you could also use them as like a control in the score, in the final score. Then still the issue is then, because this is not done that much yet. So I talked about these pretest procedures that I used in survey methodology, and they seem to be less used in the development of psychometric tests, though they are also part of the standard. So that is, this document is written conjoint by APA and some other American organizations. I think I can look the name up, but maybe it's not so important. But
Sure.
But the thing is, so these pretests are also part of the standards of developing psychometric tests. What is not sure to me is how often they are really, or how much they are really used in the development of these tests. And that would be also something, again, to do research on. So yes, it's the APA, and then the American Educational Research Association, and the National Council on Measurement in Education. So that is a standard guidelines that they published, and pretest procedures, according to these guidelines, are part of this psychometric testing development. What I'm not sure about is how much these are really used in this psychometric testing development. And I would advocate for, and I also do this in my article, to do this more or a lot. So, for example, the risk could be really investigated in detail using these pretest procedures. With this, you could identify issues that occur in each of the different subtests. And with this, you could then redesign the test and improve it to make it more fair. And this would also then be the case for these digital types of testing. So because again, you have then the interaction of the test with the person. And again, design issues can have an influence on the results that can just interact with different personality factors. So even in that case, this would be important. So to more intensively add pretest procedures to the design process of a psychometric test.
Do you have any idea how widespread that is now? Like this pre-testing procedure during test development, or is that actually happening?
I think it should be happening somehow, but maybe it's not happening that much. So that would be also a good, let's say, meta-analysis to collect all these articles and see how many researchers or developers have used the pretest procedures. I know that so I also have this advisory function for PhD students. And at the department where I work in Cologne, at the University in Cologne, they do develop a lot of measurement instruments. And so I advise some of them to do these pretest procedures, and they had not thought of it before. So from their supervisors, this advice did not come. So there I know it. The idea was not there yet to do this, and I guess it should be done somehow, but maybe not that much. Yeah.
I see. Yes, there are so many directions that we could go with this discussion. I love this. And I think the important theme that I'm pulling from all of this is that there are so many factors that we need to just be aware of as we're administering these tests, that we really can't trust that just because a test is well known or widely used, that the results are going to be 100% accurate. I mean, we have to take these personality factors into account. It also gives me confidence that robots are not going to take our jobs anytime soon, because it's not just the test administration. Of course, it's the observation and interpretation of these other factors that might be influencing someone's performance. And until we have really, really good biometric measurement and, facial scanning and who knows what else while someone is taking a test, that falls to us to do that work.
Yeah, and I think even so. So with all these, let's say, robots or algorithms, it's always still what you put in there is what comes out, and what you put in there is written by people. So even there is always a human factor, and only maybe it gets more generalized, but it doesn't mean it's neutral. So I don't think that algorithms are usually neutral, or at least there can be some biased component in there. Yeah.
Yeah, I think that's fair. So we've touched on lots of points here. It seems like this is actually kind of shocking, but it seems like there is a lot of room in this area to do more research, which is funny to me. I mean, it seems like this is kind of an intuitive piece of what we do, that of course personality is going to influence test performance, but it sounds like there's a lot of room actually to dig into this. Is that right? And do more research?
I think there is a lot of room to dig into this and do more research. So like I said, this psychometric test bias research has not really been done with personality traits. So there is a lot of room in there to improve these tests. And especially it's also this viewpoint that I mentioned, the interaction is viewpoint. So, but this is maybe like it could be like a shift in viewpoint, because, like I said, this is maybe more a viewpoint that comes from the qualitative type of research, and where you see measurement instruments not as neutral, or actually never as neutral, but there is always this interaction. And when you see things from this point of view, then I think especially it is the realization that the real world is really very complex, and it is very hard to model with statistical procedures. And but this is also then a viewpoint that you can discuss about. People have the viewpoint that we can model reality. Others would say reality is so complex. Can we even model it? But this is then again more a philosophical discussion about the world view, how we see the world, and how we want to analyze the world.
You're so right. You're so right.
And so it is like more opposing to this idea of a measurement instrument as neutral, even if it's standardized, or especially when it's standardized. And that's something that it is again not my idea, but I worked at Statistical Institute of the Netherlands in the development of questionnaires and surveys. And there was this discussion: should we have standardized measurement instruments, or should we adapt them to different situations? And actually what I'm doing here is transposing this whole idea into this psychometric testing area. Of the discussion of adaptive, but not like adaptive testing like it's generally known. So in general, adaptive testing is known as testing that adapts to the level of the person. But what I mean with adaptive testing is indeed adapting to, for example, different personality traits.
Yeah, I love that you've opened this door. Do you have any examples of current measures, either in the psychological world, the neuropsych world, or even outside our world, that are adaptive measures that we might know of or could look to as examples of how that could work?
I don't know of any. At least not when you look at standardized measurement instruments. in psychology, you also have all kinds of unstandardized measurement instruments, and you will know more about this than me. So there are more, how would you call them? Maybe unstructured or on, is it the TAT? But I'm sure you know all that. Maybe you can mention a few names.
Like the projective test, the Rorschach, or performance-based test. Yeah. Well, and so we do have those measures. We do, and we have, I think, more qualitative measures as well. So that to me begs the question, and I would love to get your perspective as a methodologist, statistician, test developer, philosopher, from your background. Is it just a given that we give up the idea of standardization if we make tests more adaptable to the individual taking them?
That could be maybe the endpoint. I'm not sure. So I think that we move towards standardization to make testing more objective. That was the idea behind it by making tests more neutral. But considering there are all these interaction elements and that test maybe can never be completely neutral, maybe we would move again towards these more qualitative diagnostic instruments. But maybe also the solution would be to combine them. So you could combine a psychometric test with a more unstructured measurement instrument, and maybe this would give you the best view and would make it possible for you to get the best conclusion out of these tests. So maybe, that would be something to work on. So to work maybe a bit back to the more unstructured types of measurement and combine them with the standardized measurement instruments. But this is just something I'm making up now. I don't know, but
yeah. Totally fine to make things up on this podcast. Yeah. Well, I'm sure there are folks out there who are just like, oh my gosh, like, what do we, if we get away from standardized objective measures, where does that even leave us as a field? And is that going to be valid? And what are we even doing with our lives? Yeah, not being dramatic, but it is an interesting question to me because I see both sides, right? I mean, the need for objective assessment is important, and seems like we have really good data to suggest that, the personality and other factors are really influencing folks' performance on these measures that we tend to rely on quite heavily to make important decisions in kids' lives. It's a conundrum.
Yeah, and it's a way in which you impact people's lives, but also like shape reality. So you could also think of that. So we shape reality when using these tests and then making decisions based on these tests. And it has a lot of implications. It is really something to think about.
Yeah, it really is. It really is. So there's so many. This is such a cool conversation. I feel like we are generating more questions than we're answering, which to me is a really engaging discussion. So it's going to have me thinking. I am curious, as we start to wrap up here, if you see a clear path forward in terms of research focus or things that anything that we could look at that would kind of help with this problem.
Research focus. So I think one of the research focus, we say it like that, this should be to do qualitative, in-depth, detailed research into this response process, and to see what happens there in the response process and try to relate it to certain variables like personality factors. I would also think that a large part of this research goes through maybe also testing psychologists like you, because, for example, the risk has been used for many years already by people like you, and I'm sure there is a lot of knowledge there, a lot of information to be collected and disseminated, written up, disseminated, and that can be used to evaluate these tests and to further more develop these tests and to improve them. So I think that would be an important issue. And then, of course, there's also the dissemination. So I'm also not really aware of and how far in research somewhere in the world, maybe people are already doing research or already writing guidelines to take this into account, and then how far this is disseminated among psychologists over the world. So that is also an important part, I think, of science, of research. So of course, it's not useful to do research and to write it up and then nobody reads it and it's not disseminated. So that would be maybe also an important focus in research. And then, of course, then again, to try to generate data on personality factors and to relate them to test bias in psychometric testing. And I think it would be good then if I would choose one test, I would choose the risk. So for all the reasons that we have discussed, it's one of the most used tests in the world. It's used for a lot of decisions. So maybe this is an important test to do research on. But of course, this would be something for Pearson. I think this is published by Pearson, right? It would be actually a task for Pearson, I guess, to do this research and to develop and look more into this.
Sure. I'm sure they're listening.
And let me think. Yeah, there could be also more research then again into the more unstructured tests like the projective tests and how they can be used maybe in conjoint with psychometric tests to draw conclusions for diagnostics. So there could be research into that. I think that would be a good way of doing research. I think I have a colleague who does research on that. So that would be good. Yeah, I think that's all I can think about at this moment. Yeah. I'm sure that in 5 or 10 minutes when we have closed down, I will have a new idea, but
of course,
that's how
of course.
Yeah.
No, that's plenty. That's plenty. Yeah. Yeah. This has been a fantastic discussion. Yeah. I appreciate you sort of going all sorts of different directions as we talked and, bearing with some curveball questions, but yeah, this is important research. And, we will of course link to your article in the show notes that we've referenced and a couple of the other things that we've mentioned. But I really appreciate you coming on, especially because this is evening time for you, being over in Europe. And, I'm just grateful for your knowledge and for your time. Thanks.
It was my pleasure, and thank you for listening to me. And I hope I said something interesting. And maybe we can discuss sometime again.
I would love that.
So thank you a lot. Yeah.
All right, y'all. Thank you so much for tuning into this episode. Always grateful to have you here. I hope that you take away some information that you can implement in your practice and in your life. Any resources that we mentioned during the episode will be listed in the show notes, so make sure to check those out. If you like what you hear on the podcast, I would be so grateful if you left a review on iTunes or Spotify or wherever you listen to your podcasts. And if you're a practice owner or aspiring practice owner, I'd invite you to check out the Testing Psychologist Mastermind groups. I have mastermind groups at every stage of practice development, beginner, intermediate, and advanced. We have homework, we have accountability, we have support, we have resources. These groups are amazing. We do a lot of work and a lot of connecting. If that sounds interesting to you, you can check out the details at thetestingpsychologist.com/consulting. You can sign up for a pre-group phone call and we will chat and figure out if a group could be a good fit for you. Thanks so much. The information contained in this podcast and on the Testing Psychologist website are intended for informational and educational purposes only. Nothing in this podcast or on the website is intended to be a substitute for professional psychological, psychiatric, or medical advice, diagnosis, or treatment. Please note that no doctor-patient relationship is formed here, and similarly, no supervisory or consultative relationship is formed between the host or guests of this podcast and listeners of this podcast. If you need the qualified advice of any mental health practitioner or medical provider, please seek one in your area. Similarly, if you need supervision on clinical matters, please find a supervisor with an expertise that fits your needs.